It's a great pleasure to see so many people here this afternoon, because we thought there'd be a huge amount of competition from upstairs and everybody would be listening to the talks about brains and imaging. So thank you all for coming. Because clearly this is a very important issue, and one, in fact, we know relatively little about, which is why I've said that I'm talking about autism in adulthood. But as for autism in old age, the question marks are there, because really we know so very little in many ways, except that we know that there are going to be many challenges. And of course, when one looks at most of the research, most of the very high quality research anyway, that's been done in the field, that's focused on children. But of course, autism doesn't stop at the age of 6 or 16. It goes well into old age. And one of the programs of the National Autistic Society over recent years has been to try and change the concept of autism. So moving from children and adolescents to elderly people and focusing on the help that they may need. What we do know about adults, certainly as far as adults with autism living in the UK are concerned, is that in many ways they're a very deprived group. So that a recent study done by Terry Brewer and his colleagues looking at adult psychiatric morbidity across the board, but also in people with autism, their figures for prevalence of autism in adults are very, very similar to the prevalence figures for children. But as a group, we know that including those of normal IQ, they're very socially disadvantaged in many ways, so that they're very often living on benefits, they're in social housing or still living with their parents. Educationally, they're much less well qualified and trained than people who don't have autism. And despite their very significant needs, they're generally under-supported, ill-supported by social, educational and welfare services. And if one looks at measures of social deprivation, this group tends to be in the lower sort of quintile for social deprivation in the UK. And estimates of the lifetime cost of autism are approaching £3 million per person over the lifetime because of their very significant needs. And the extent of those needs has been illustrated in a number of fairly recent follow-up studies. One that we were involved in fairly recently, although we're now following up this cohort. This was a group of individuals who were first seen at the age of 7 years, and we followed them up at the last sweep when they were around 30 years old. And their overall IQ was not particularly impaired. We reconfirmed diagnosis as in adulthood, and the sorts of figures we got are very characteristic of other follow-up studies. So relatively small numbers of people having formal education at school, leaving school with formal qualifications, relatively small numbers in work or having friendships, and a very small proportion living entirely independently. So in their early 30s, many of these individuals still very dependent on their parents for care. Now, the situation isn't entirely negative, and some studies have indicated some positive aspects to the stage of transition to adulthood. So, for example, very typically, one sees an overall reduction in the severity of autism symptomatology from child to adulthood. Often, there's a decrease in problem behaviours, and a decrease in stereotyped and repetitive behaviours, particularly when people get into the sort of middle, older adult years. And also there tends to be improvements in social reciprocity, and often these improvements start in adolescence. And there's a series of studies just coming out by Martha Seltzer and her colleagues, which illustrate many of these positive points. On the other hand, the same studies have indicated a number of rather negative findings. So although there may be some improvements in adolescence, the behavioural improvements often sort of tend then to slow down. Employment rates are low generally across the board, with many individuals who have followed up either in sheltered or voluntary work schemes, but not in the open job market. And adult day activities are often significantly lower quality than the programs that individuals experienced when they were in school. So facilities becoming poorer. And also what's particularly concerning is that facilities and provision for adults with autism who are of normal IQ tending to be much poorer than facilities for individuals with autism who have IQs in the intellectual disability range. Other difficulties are increases in mental health diagnoses. So in Martha Seltzer's studies, for example, she found that over 50% of adults had a diagnosable mental health problem. And in turn, that led to increased use of medication, so that in her group, which, American figures are not always translatable to other countries in Europe, but in that group, almost 90% of adults on at least one medication, and over 60%, and many of them on multiple medication as well. And the other thing is that once people start to take medication, they tend to carry on with it through much of their lives. Another study that was conducted by a group at the Maudsley Hospital where I work, looking at mental health problems. This was a mixed ability group of adults from very low IQ to IQ well within the normal range, and looking at new disorders in adulthood, new mental health problems, around 16% showing clearly diagnosable mental health problems, and another 6% showing emotional and behavioural problems that were different to what had been shown as children, although that was more difficult to put a label on those. And many of those difficulties are related to anxiety and depressive types of disorders, often in some cases accompanied by OCD or by catatonic type of states. As in other studies, rates of schizophrenia seeming quite low, but the main problems being anxiety and depression types of problems. And one of the things that was looked at in that study was whether people of higher intelligence were more prone to mental health problems because of their self-awareness and so forth than individuals of lower intellectual ability. But in fact, rates of mental health problems were really similar in both groups. So just to summarize, and in terms of the factors affecting outcome, we also found that, I've slipped over one, I'm just going to skip over that. So in summary, adulthood bringing about new challenges and changes, some of which are positive, but others not. And if one looks at follow-up studies across the board, you find that around 30 to 40% of individuals do show quite marked improvements in adulthood. But in almost all the follow-up studies that have been done, there's a small minority of individuals who do show an increase in problems. Sometimes these are challenging behaviours such as hyperactivity, aggression and so forth. But in other cases, it's more exhibited in a loss of skills. Individuals who did communicate, who've stopped doing so. People who seem to be interested in the world around them, who are no longer showing that interest. And in some studies described as a sort of slow intellectual decline. Almost as if this was a form of regression. But I think it's really not a regressive problem. I think that if one looks at these loss of skills, what you find is the loss of interest, the lack of communication, often coincides with increased stresses, trying to cope with the transition from school to university, for example, or trying to find work. The lack of structure that many individuals experience once schooling finishes can give rise to many problems. And of course, there's all sorts of other disturbances in adult life as well, losing parents, having to move into a residential setting, losing staff in residential settings that people have become close to. So in very many cases, the increase in anxiety or the loss or the apparent loss of skills can be due to, or seems to be due to, environmental factors and the lack of adequate social networks. And I think a good illustration of the importance of good social networks comes from this study of Farley and colleagues that was carried out in Utah, in Salt Lake City. And their results are considerably better than lots of other follow-up studies of adults. So this was a group quite similar to the one we've been following up over the years. So an IQ not in the particularly low range, similar age groups to the ones we've been following, with diagnoses confirmed in adulthood. And in that study, considerably more people in going on to college and university education, well over almost a third in full-time work, over a half developing friendships, and around a fifth having close relationships with other people, some having married, some having children of their own, and almost a third living pretty much independently. And the striking difference between that study and most of the other follow-up studies is that the people, pretty well all the individuals, were all members of the Church of the Latter-day Saints, the Mormon Church, which of course is a very sort of close-knit organization, a very sort of almost cradle-to-the-grave organization, which supports its members very, very strongly, whether they have disabilities or not. And it does seem with that level of community support, then the outcome can be much greater and much more positive. But of course, for many individuals, that support is lacking. And an analogy that's used very, very often by parents is when their children come to school leaving age, often having had good programs, good education up to the age of 16 or 19, they describe it actually as falling into a big black hole, that really services disappear, help for them disappears, help for their son or daughter disappears, and the structures that are needed simply aren't there. So how can we go about trying to improve this situation?